Kim Smith with Vocal New York, and we are here today with our State Assemblyman Damon Meeks, other local elected officials, and we have the only harm reduction site in town. We've got Trillium Health. And we are here today to send the message of not one more. Not one more preventable overdose death.
The pandemic's impact continues to reveal more and more ways that really Rochester is reeling. People are under a lot of stress, pressure, pain, job-related, family-related, people's personal lives. It's awful to realize that a lot of the steps we've had to take to protect ourselves from COVID put so many at risk at the same time for the anxiety and depression that comes from social isolation, from uncertainty about the future, and economic stress. So as a result, of course, fatal drug overdoses are at an all-time high.
Last year was the worst year in recorded history for preventable overdose deaths. We lost 5,100 New Yorkers. In Monroe County, we lost 137. These deaths are preventable.
Opioid deaths are at crisis levels. In my neighborhood, 3 people died of overdoses. They were in one house. They were parents with children. They had moms and dads and friends and coworkers and children who loved them. But their humanity was lost by those who wanted to make a point about addiction and shame addiction. You know, we could solve this problem today if we looked at victims of opioid addiction, if we looked at people who use opioids as human beings.
Yes.
Opioid addiction is in a lot of places that we don't think to look. People have an image in their minds of people who use drugs that just doesn't look like members of their own families. And until you experience a family member who has gone through this, you don't think it's about you.
Right.
But this is about all of us.
That's right.
Nobody uses alcohol for the first time thinking that they're going to become an alcoholic.
That's right.
Nobody uses heroin for the first time thinking that they will become addicted. And nobody uses a doctor's prescription thinking that they will turn to heroin a few years later. We can't go back and change the failed war on drugs. We need to focus on what we can do today. We can reduce harm and we can save lives by changing our approach and our policies and the way we see people in crisis. We cannot arrest our way out of this and watch people die. Not one more.
Not one more. Not one more.
People have a misunderstanding of harm reduction. We think it's condoning bad behavior. Yeah, heroin's illegal. Let's criminalize the trafficking, but decriminalize addiction. The life we save today is someone who can kick addiction tomorrow. You can't get off opioids if you're dead. If you're addicted to heroin, you are going to use heroin. If we ever want someone to not be addicted, we can't have them die. Harm reduction means preventing disease, preventing harm to the community, and it means saving lives.
My name is Julie Ritzler-Schelling, and I have had the pleasure of working alongside the harm reduction team at Trillium Health, many of them right here behind me, for almost 10 years. This isn't something that's new for us. Trillium Health has been providing harm reduction services in this area since 1994. We are thankful for our legacy organization, AIDS Rochester, for working tirelessly to establish this evidence-based and proven best practice program in Rochester. Harm reduction works. Our services are positioned at the beginning of the treatment continuum and throughout that treatment continuum. We wholly accept people who are using drugs as humans. Humans first. We provide information, education, skills building, and tools that people can use to remain as safe as possible while they are using drugs. This was our original definition of success, to improve the health and wellness of people who use drugs and their communities. We do this free of stigma, free of any judgment. We build connection and trust with individuals, restoring dignity and worth. Our team of community health, harm reduction, and outreach and engagement specialists work with people every day, on site at 39 Delavan Street, out in the field in the communities where public drug sales and public consumption are prevalent, and in the rural counties that surround Monroe County. They provide person-centered services that address people's most basic needs: survival, food, water, clothing, and shelter. From January through June of this year, we served over 800 individuals, connected over 200 people to healthcare and services, and over 100 people to substance use treatment programs. Not at Monroe Avenue, but at Delavan Street, at Central Avenue. Trillium Health was the first organization to begin training individuals in the use of Narcan in Rochester and distributing kits free of charge. This was an expansion of services funded by the New York State Department of Health in 2006. We knew then that access to this drug, which can help to reverse an overdose caused by opioids, would prove crucial in combating this opioid epidemic. As opioid use increased and fentanyl and other opioid analogs entered the drug supply, we were no longer dealing with an epidemic. We were, and we are currently, dealing with an overdose crisis. During the first 6 months of 2021, we have trained over 1,300 individuals in how to recognize and respond to an overdose.
Yes!
And distributed over 1,350 Narcan kits.
Yes!
Our harm reduction team, again, some of the people behind me here, have personally reversed multiple potential overdoses in the field on the streets of Rochester, in our parking lot, on site at our harm reduction location, as well as our clinic location at 259 Monroe Avenue. Our definition of success now has become that our clients and patients live to see another day.
Yes, not one more.
We need to do better. We must do better. The increases in overdoses and fatalities that we have seen at the national, state, and local level have to be addressed. Trillium Health is firmly committed to the health and well-being of this Rochester community and the communities of people who use drugs. We are, and I am personally willing to meet with anyone else wishing to collaborate on a safer way forward and out of this preventable health crisis. Thank you.
Not one more.